George Kilpatrick, Inspiration for the Nation. We're pleased to be joined by Dr. Sharon Brangman. She is the chair of the Department of Geriatrics at Upstate Medical University, also the director of the Geriatric Medicine Fellowship Program and director of the Upstate Center of Excellence for Alzheimer's Disease and the director of the NAPI Longevity Institute. We could go on and on and on, but my favorite thing is she's our go-to physician when we want to know about COVID-19 and all of its variants and what is happening right now and what we should do. Dr. Brangman, you certainly have sounded the alarm. You've continued to sound the alarm, and dare I say you've been right all along. What are you saying to us right now, and update us on what is happening right now with COVID-19 and the various variants?
So first, George, thanks for having me. But the pandemic is not over, and this surge of the Delta variant shows that. The pandemic is still going on. We're making progress, but I think we're celebrating a little bit too soon. Now, the Delta variant is a very contagious form of the original coronavirus. Every time the virus spreads and jumps from person to person, it increases the chance of mutating or changing its form. And that's exactly what happened. We now have a new form of the original virus that is more contagious. And it is challenging to those people who have not been vaccinated, but it's also causing a challenge to those people who are vaccinated. So first, we can talk about the people who are not vaccinated. These are people who have chosen not to take the vaccine for a variety of reasons. And those people who just wanted to wait and see, I would encourage them that it's no longer time to wait and see. Either you're going to get the vaccine or you're going to get the virus. And when you get the virus, you could get very sick. You could die. The vaccines keep you from getting very sick, may keep you out of the ICU and keep you from dying. And if you don't get the vaccine, there's nothing that you have to protect yourself. Now, this variant, as you may have heard, is very, very contagious. It's as contagious as chickenpox. And those of us who are parents know that chickenpox spreads very, very quickly.
Yes, it does. And so as I was listening to you, I was thinking of a physician. I heard a story, so it's anecdotal, that an individual was considering the vaccine, went to a physician, and the physician, and this was a person who was younger, like not in my age group, where I would be obviously higher risk, but the physician said, well, because you're young and because you're young, you're not as it's not as urgent for you. Can you dispel that or challenge us on that, just based on that anecdotal story?
So that's a problem. I think when the virus first came out, it was really hitting older people. This was a virus, as you will recall, that started in a nursing home, and it had a very big impact on older people or those people who had a long list of medical problems. But that's because they were the first ones in line to get it. Now that a lot of older people are vaccinated, younger people have that misconception that this virus doesn't really impact them. But now that the virus is starting to hit them, we are seeing that they are getting sick too. So right now, the people who are in the hospital are younger people who did not get vaccinated. The other interesting thing is that even if you get a very mild case or you have very minimal symptoms or no symptoms at all, this virus can still impact you. There's a problem called long haulers. These are people who might have gotten a very mild case of the virus, and then months later, they are still not feeling well. They may be extra tired. They can have their heart racing. They could be short of breath. They could have headaches. There's serious problems when this virus gets in your body. So we have a lot of information out there that is not quite on point. And it is the age of social media where everyone has an opinion, including those who have no science background. They're not doctors. They are talking about things that are not true and people are believing it. So I really want to encourage people to get their information from people who are trained, who know what they're talking about, who have experience with science and medical care, and stop listening to your Aunt Tilly who put something on Facebook or Twitter.
Yeah, you started talking about the unvaccinated people and the fact that they're at much higher risk because this Delta variant is much more contagious. Are there other variants out there that we need to be worried about?
So there are other variants circulating, but right now Delta is the most predominant. And as long as this virus has a place to land in other people, we are going to see other variants come up. And the concern is that we'll get a variant that will be stronger than the vaccines. We are already getting information that we may need to have a booster shot because the current vaccines, especially if you've gotten them for several months, start to get a little bit less effective. And as we get these stronger and stronger variants out there, we may need to kind of fortify ourselves by getting a booster shot. So the most important thing is for people to get vaccinated to get this virus out of circulation. When it's out of circulation, it reduces its chance of mutating and changing and getting stronger.
You said you wanted to start with the unvaccinated people. What about those of us who are vaccinated and our risk factors? Because we are seeing, I believe in Los Angeles, for example, we're seeing an uptick amongst those who are vaccinated.
So that's the problem when you have a strong virus like the Delta variant. It can still impact people who have gotten vaccinated. Vaccines are not 100% protection. Even though they are a good and strong protection, they're not 100%. So when you have large volumes of the virus circulating and you have been vaccinated, you can still pick up the virus. And now there's information that you could actually transmit it to other people. So that's why I would recommend that as long as you are sharing indoor air with someone who you do not know, who may not have gotten the vaccine or who could be positive, you should be wearing a mask. And people ask me, oh, well, can I go to the grocery store? Can I go to a concert? If you're doing something outside, your risk goes down. I would avoid large crowds because that's where the virus can spread because there are going to be more people there without a vaccine. And anytime you share indoor air with large groups of people, I would mask up.
Let me ask this. So there's two things that may affect whether people get the vaccine. You just said it. By saying the vaccines are 100%, not 100% effective, that triggers in somebody's mind, well, then why do I get it? So that's number one. And then number two, who's more at if I'm vaccinated, is an unvaccinated person the more risky person for me, or are they the more risky person for themselves? Clear that up for me.
Okay, so first of all, the vaccines are very, very good and they're very, very effective.
Mm-hmm.
But we have not made anything that's 100%. Right. The vaccines that are made by Pfizer and Moderna are about 95% effective, but they're not 100%. And their effectiveness may go down a little bit over time, and they may go down a little bit in terms of protection against the Delta variant. However, if you have the vaccine in your body, it is going to protect you from getting seriously ill. So even if you do pick up the coronavirus, it's very unlikely that you will get very, very sick and that you will die. So nothing is ever 100% in medicine. Right. But why would you gamble with something that is not going to give you any protection at all? So if you do not have the vaccine, then you are at risk for getting very, very sick and for dying. If you have the vaccine, even if you got the virus, it's less likely that you're going to get very, very sick and die.
And so to the question about if you're unvaccinated and I'm vaccinated, your unvaccinated status is more risky for me, as I'm understanding that, right?
But when you're unvaccinated, it's risky for yourself, for the person who didn't get the vaccine. And it's also risky for people around you because you are now helping to spread it. If
You
you
are.
don't have the vaccine, then you're helping to keep this pandemic alive and well because it's keeping the virus in circulation. What we need is to get as many people as possible vaccinated so that the virus gets out of circulation and doesn't spread.
So here are some of the things that I have been doing. And these are not doctor recommended, not Dr. Brangman recommended. I do go to the gym. You're like, but I started wearing my mask again. I'm the only one. But I started wearing my mask again in the gym as a precaution. And I when I go into some in the stores, I started to wear my mask again. And I'm the only one, but I started to do that. You're proud of me, right?
That's very smart, George. Anytime you're sharing indoor air with people you do not know, you should be wearing a mask. And that means the grocery store, that means gyms, that means anywhere where you're inside a building.
And we are seeing across the country, Doctor, and you can give me any last thoughts about this, but we're seeing across the country some counties introducing mask mandates. I know in the latest briefing that I saw from County Executive Ryan, he's not going that far, but because he's thinking that vaccinations will be the thing that we're going to push. But some counties are starting to have mask mandates again, which is now causing another uproar. You've got people talking about freedoms and things of that nature. So it's a very, very, very trying time. I'm vaccinated. You're vaccinated. What's your last thoughts for our listeners?
Well, vaccines are important and masks are important. Those are the two main things that can get the virus under control. I'm sick of the pandemic. I'm sick of wearing a mask, but I would be more worried about getting very sick and being in the ICU and dying. So it is not a matter of freedom. It's a matter of living to the end of this pandemic. And the best way to live and see the end of this pandemic is to get a vaccine and wear a mask until this pandemic is over.
And if there's Black folk who are still, I was at an event, we have an event later today at the Sankofa Park where we're doing the family health gatherings and encouraging people to get vaccinated. I was talking to a woman at the last one, and she was insistent that she wasn't going to get it. I've had professional people who counsel and encourage other people say, I don't know what's in that thing. And even suggesting, I have, some medical things going on with me. And they said, well, when did you have the vaccine? Like they're trying to put all of that on the vaccine. I guess there's nothing really what you can do about that, but there's still this strain of Black folk who are resistant as hell and will not do it. And at the same time, the numbers will continue to rise in our community. So I don't know if there's anything more to say to that, but
well, I think it's unfortunate because people do get suspicious, but this is not the time to be suspicious. And you have to trust medical science and doctors who know what they're talking about. Unfortunately, if you don't get the vaccine, that's going to be on you, and it will be very sad. We want to see people live to the end of this pandemic, and the vaccine and masking up is the best way to get there. So we keep talking, we keep trying to get people to understand that this is not a major conspiracy, this is not a hoax, this is not people getting targeted to be killed or something. This is actually good science, this is good public health information, and I would like people to listen to the right people and make a good decision so that they can be safe and live to see the end of this pandemic.
Dr. Sharon Brangman is the chief of geriatrics at Upstate Medical University, director of this, director of that. Yeah, she's got a lot of titles, but she's actually she's somebody that looks like you and somebody we can trust. And believe me, she knows what she's talking about. Thank you, Dr. Sharon Brangman, for sharing the latest with us. Come back again when we've got some other news to share around these issues. We're going to keep doing our thing to make sure that our communities informed. Thank you so much.
Thank you, George. Bye-bye.
Inspiration for the nation.